So for today, we are privileged to have in our midst an entrepreneur, an innovator, and someone who develops easy-to-use point-of-care diagnostic test. That's why I asked whether there are some engineering students here, biomedical engineering students. Last year, March 2020, he developed, together with the KNUST, the University of Science and Technology, they developed what we call a rapid diagnostic test for COVID-19 here in Ghana. By way of education, he went to Kwame Nkrumah University of Science and Technology. He also did his master's degree and PhD over there. And then he has a master's from Purdue University in the United States of America. So, ladies and gentlemen, let's put our hands together for Lord Anthony Basing.
Good morning. You guys are feeling sleepy, eh? I can imagine. Okay, so I've been asked to talk about charting new and unfamiliar paths, ethics, and personal values in business. Okay, so I'm going to be talking about my life and how I started and where I am right now and all of that. But as I speak, I would be drawing lessons I have learned over the course of the few years. It's not been an easy journey for me, mainly because I started a company which is currently the only company in Africa that does what it does, right? So when I started the company, we did not have any support. When I started, there was nothing like that anywhere in Africa. We didn't have any support. We didn't have anybody doing what we do. And as of now, it's still the same thing, just that a few companies like that have sprung up in South Africa. But we are still the only African-owned company doing what we do. And so it was not a familiar path at all. And I have failed and restarted and failed and restarted and failed and restarted a lot of times. I'm going to start by telling you a few of the things that we've done and then tell you how we've been able to achieve them. I remember when I was in the university, there was a guy who was coming to give us a talk on how to make $1 million. And my roommate at the time, Frank, came and was like, oh, let's go and listen to him. And then I asked him, the guy is coming to talk to us about $1 million. Does he have $1 million? If he doesn't have $1 million, me, I'm not going. Because if you cannot practicalize what you're going to talk about, then why should I come and listen to you? So usually, before I talk to you guys about ethics and how to put that into your business and grow your business, I need to demonstrate to you how far we've come and why it's even worth it for you to listen. Okay. So currently I am a lecturer at the Kwame Nkrumah University of Science and Technology. I teach microbiology in the medical school. I also teach laboratory methods, diagnostics in the Department of Medical Diagnostics. I also teach part-time in about 4 universities in the US, where I teach what we call lateral flow. I would explain what lateral flow is. It's a technology used in developing test kits, and then I teach it. I also do a number of seminars. Recently, I was in Kenya, and I did a seminar on point-of-care tests, how to develop some of these tests. So that is my academic life. In the business front, I founder and CEO of Incas Diagnostics. Last year, Bill Gates gave us $2.8 million worth of equipment. And that was because I was selected as a Gates goalkeeper. And every year, the Bill and Melinda Gates Foundation, they select 10 people across the world as Gates goalkeepers. They give everybody $100,000. I was fortunate last year to get it. And instead of giving me $100,000, they gave me equipment worth $2.8 million. So, I was also fortunate. I was also very fortunate that I was actually one of the, in fact, the only Ghanaian to have ever been nominated for a prize called the Innovation Prize for Africa. And that also gave us some cash some time ago. Last year, 2020, I led a team from 5 countries, so Ghana, Cameroon, South Africa, Nigeria, Senegal. The World Health Organization organized what we call the COVID-19 hackathon. And I led a team from 5 different countries to win it. So that also got us some bit of money. I am telling you about all the money because when I talk about what we've been doing and some of the challenges, we realize that finance is one of our major challenges. Okay. And I remember last year, I went for a pitch in Ghana, and the comment one of the judges made is that, oh, you've won a lot of money. What have you been using all the money for? Okay. And that is one of the problems we have in Ghana, because we do not understand research and development. We do not understand that people can spend millions of cedis on research and development and will still not have a product. Okay. When we hear millions of cedis, millions of dollars, and then we assume that your company should be doing very well. So I'll talk about all of these in due course. The final thing I would say is that in 2019, one of my devices, or one of the platforms I had developed, which I patented in the US, was selected by the World Health Organization as one of the top 30 innovations in health. So 2019, it was one of the top 30 innovations in health. So generally, what I do is to develop diagnostics so that when you go to the hospital and you're asked to go to the lab, it's very easy for us to test you and give you your results. So basically, that is what I do. And for the next couple of minutes, I am going to be talking to you about the journey, how I started, and my motivations, what has gotten me here, and then some of the challenges, especially the ethical ones. I'm going to tell you stories of when I could have taken the easy way out, when you could have just sorted people out for things to be done for you. I'm going to tell you a story about how I have refused to do that. The repercussions, the immediate repercussions that I had to face, but the long-term gain I have gotten from not doing some of those things. So that is going to be my story. So I hope you would listen and ask me as many questions as you can. So in all of this, I'm going to talk about work ethic and then personal ethical principles as well. So it's not just going to be about oh, okay. So I asked one of my staff to bring some of the products we have. Let me just show you some of the products. Oh, and by the way, this is a test for drugs of abuse. So marijuana, cocaine. So this product is able to test about 10 different drugs using your urine. So cocaine, marijuana, tramadol. So anyway, let's start. I also have pregnancy test and all of those ones available, if you want them. And our pregnancy test is just 50 pesos. So, how much do they sell pregnancy test? Hey! Anyway, yes, 50%. Don't worry. It's just an icebreaker. Let me finish the talk, and then afterwards we can talk about this. So my journey actually began in the university. I was in KNUST, and then my dad, who was our breadwinner and everything. My mom was working, my dad was working, but my dad was sick. We sent him to 37, and he was diagnosed of cancer of the left kidney, and that actually started a series of events that has gotten me here. In first year, I never wrote. During my time, we used to have we still have it, SNID loans, where you can apply for a loan, and then while you're in school, they'll give you money. I think it was every semester or every month. I don't really remember. They'll basically be giving you money, and then when you finish, you pay for it. So that was the SNID loan. And when I started school, my parents were like, "Oh, don't worry about SNID loan. We'll be able to take care of you." So I didn't apply for any SNID loan, and I just went. And then when I got to third year, unfortunately, my dad had cancer. It was the left kidney that had a problem, and he had to be in the hospital. We had to do surgery. We had to do dialysis and all of that. And obviously, money was channeled to taking care of him. So there were lots of times I did not have money. Okay. My roommate at that time, he was called Frank. I had other roommates, Elliot and the rest, but I speak about Frank because Frank and I were very close. We still are. He's a doctor at a police hospital right now. And I remember he used to cook, and then he would leave food for me because he would realize that for about 3 or 4 days I will not eat. And yet we'll all be studying together. We're in the same program, so we'll all study together and all of that. So I started to survive. I started doing photocopies. So this is what I would do. I knew there were past questions, right, that people wanted. And some of our juniors would always ask us for past questions. So I'll take all the past questions I could gather, go to the photocopy unit, let them do photocopies, plenty. And I'll get a discount from the photocopies. And then I'll tell the guy doing the photocopy that, "Oh, give me 3 or 4 days, I'll come and pay." So if the photocopy was like 10 cedis, at that time we had thousands. We didn't have so 1 cedi was 10,000. So I'm an old man. Okay, yes. So if it's like 100,000, okay, I'll tell the guy, "Oh, I'll come and pay that. Give me maybe 3 or 4 days. I'll come and pay." And then he'll give me a discount. Then I'll sell the photocopy to my mate and anybody that needed it at premium. So the cost of the photocopy plus a little markup for the cost of the questions or any of anything Pasco, I'll get it for you. If the photocopy is 1 cedi, maybe I'll sell it to you at 1 cedi, 50 pesos, something like that. And people patronized it. Like I was getting a lot of sales, so I'll make profit. Go and pay the photocopy guy, keep the profit a little, then do more copies and all of that. Within a short time, it became a business. That was what basically allowed me to survive school. That and of course Frank, because I was getting food for free. Frank would cook and give me some food and I eat. So all in all, it was quite okay. And then we moved to Konfanochi Teaching Hospital. It was basically the same thing. And then I finished school. When I finished school, I had to do a 1-year internship at the hospital. During this process, we're going to be paid an allowance, but I had gotten used to business, right? So I decided that, okay, I needed to do something on the side so that I would be able to have enough money. And so I decided to go work for a man who had a lab. He was called Doxa Lab. So I went to work for him. And I worked for this man for almost 6 months, and he never paid me a peso. Okay. Because according to him, he was teaching me the ropes. Okay. So I worked for him. We would go take samples to come and run. Once in a while, he'll give you something small, like take this and buy something. But for a salary, I never got it. For over 6 months, I was working for him. But while I was working for him, I learned the ropes. I learned about the business he was doing. I learned a lot of things. Okay. When it was time for me to leave, he convinced me to stay a few more months, still without pay. I still worked for him for a while. And then one day he calls me and he says, "Oh, I'm going to be a pastor. I'm going to be a lighthouse chapel pastor. And I need somebody to take care of my business. But it's difficult to find somebody who is trustworthy enough to take care of the business. So this is what I would propose. I want to sell my business to you. You can pay me little by little. And then when you finish paying, then you can keep the business." So I like the idea because at that time he was doing food vendor screenings in Kumasi. He was the only company that used to screen food vendors, and that was giving me a lot of money. So I like the whole idea. I spoke to a few people and they said, "No, I think that you should take the business side, but the company itself, the company name and everything, you should get your own company, but take the food screening business. Because one day he might come back and say, I want my company back. By that time, you've made quite a number of investments and it's going to cause issues and all of that," which I agreed. So I started Incas Diagnostics in 2010 as a business to basically do these food vendor screenings, but also because I felt that lab tests were too expensive. Okay. You meet a patient, the patient has to do a lab test, the patient leaves, and then you don't see the patient again. Then within a few weeks, you meet the patient somewhere, the patient recognizes you and says, "Oh," you ask the patient, "Oh, I never saw you again." The patient says, "Oh, yes, the lab was too expensive, so I didn't do it." So I decided that, okay, I wanted to start a lab that would offer very moderate costs for patients. Of course, I was very naive at the time because I had forgotten to factor in the fact that every single thing that was used to do the lab test is imported. We don't produce any of them in Ghana. Every single of them is imported. Even the syringe that will take the blood sample is imported. And once it's imported, they will pay duties. Somebody will import them and then sell to somebody who also sells to somebody before it gets to the lab. And so by the time you finish, it gets to the lab, something that was probably 100 cedis will now be around 300 cedis. And so if you sit down and then you calculate the cost, and it's maybe in the US, it's just 100 cedis. And then you assume that, oh, I want to start a lab, I'll just take 105 cedis and everything will be okay. You've been naive just like I was. So 2 weeks after starting the business, I realized that the aim that I wanted to, reduce the costs to values that were very, very high. Very, very low values. I wasn't going to be able to achieve that. So I had to do something else. So I concentrated on the food screening to get me some money, but I paused on the lab because it it was even going to be more expensive because I was doing small scale. I could not negotiate prices lower. So I started to look for ways to still reduce the cost to the level that I wanted. And this led me to Mali, where I had been selected for a program by the NIH. The NIH is a National Institute of Health in the US. So every year they advertise anybody who is in health or molecular biology or any of those stuff. They advertise trainings. And one of the training was the cell biology workshop, which is held in a different country every year. Um, in 2011, 2012, it was held in Bamako. So I left, I went to Bamako. And during the program, there was this admiral from the army, a lady. She came to talk. She was in the Army Research Center, and she came to talk about point of care tests, how to bring from the laboratory to the patient. And I remember her talk. Her talk was just 30 minutes, but it left a great mark because she demonstrated how easy it is to develop diagnostics. And after that, I was hooked. So I started to look around for places I could go and learn how to develop diagnostics. I knew that there was nowhere in Ghana I could learn that. There was cool, you can go and learn how to develop diagnostics. So I started looking for companies that were willing to teach me. And so I wrote to this admiral, telling her that I really wanted to learn. So she told me, oh, you can go to DCN. So she did a quick introduction, DCN Diagnostics. DCN said, oh yes, you can come and learn, but you need to pay $4,000 every month. So I said, okay, $4,000, I don't have some, but I'll try and raise that. So all the savings I had made, I liquidated the savings. I took a loan from a few friends, and then I went to San Francisco, California, it was San Diego, California rather, to learn how to make test kits. Between 2014 to 2016, I went to learn how to develop test kits. Coincidentally, in 2016, I had finished with developing my first test kit, which was called a VAG kit. It was a 3-in-1 test for vaginal infections. So it's a test that allows you to use your urine. So if you're a lady and you have a vaginal infection, when you go to the hospital, somebody will take a swab. Most of the time, a male, take a swab, put it under you, test it for 3 days, give you your results, and then you go and see the doctor, and then you are treated. I had developed this test where you don't need to do that. The problem with the first one, going to the hospital and all of that is, first of all, it is invasive. Somebody is putting something inside you. Okay. Secondly, it takes a long time. It takes 3 days for you to get your results. Thirdly, it is stigma. You go there and probably the person who's going to take your sample is a male. You are not very comfortable with a male. You don't have any relationship with looking at you naked and all of that. And it was expensive. So I had developed a test where you could do at home. You use your urine. So you just pee, test, and it'll be able to tell you exactly what's wrong with you. And then we had developed an app at the time so that you can scan it and then speak to a doctor, so that once you have an infection, you buy the kit. You don't need to go to the hospital. You don't need to go anywhere. You test, know what is wrong with you. You get a prescription, go to the pharmacy, and you buy the prescription. So that was what I had developed at that time. From being at DCN all this while. Funny enough, in 2019, DCN selected that product as one of the top 5 innovations for lateral flow for the decade. For the past 10 years, it is one of the top 5 innovations when it comes to diagnostics development. Anyway, so I developed this 2016. I was selected for the Mandela Washington Fellowship. The Mandela Washington Fellowship is it's a fellowship that the U.S. Embassy would basically select you, send you to the U.S. You train in an institution, And then afterwards, you move to Washington, you get to meet the president, you get to meet a few people. So I met President Obama in 2016. So you talk to them and all of that. And then you have the chance of getting some funding. So in 2016, I got some $25,000 from all of this. And then I came home. So when I came back to Ghana, I was very naive to think that, oh, I had a product which was working. I had tested the product at the CDC in Atlanta, which is like the WHO of the US. So, and it was working. Everything was going to be all right. So I came and quickly set up everything, and I started. We did a little bit of production, and we're going to go to the Ministry of Health, let the Ministry of Health take all of this and start supplying to everybody and all of that. I started counting the money I was going to start spending in my head. From September 2016 to 1st June 2017, I visited almost every single institution in this country that could help us. All of them said no. All of them said no because, one, either they didn't believe that it was possible, because at the time nobody had developed anything like that in the world. So they thought it was impossible. Two, they were just not interested and all of that. It was very, very frustrating. I was looking for money to add to the $25,000 to buy equipment to go into large-scale production. I went everywhere I could. Nobody was willing to help. So finally, I got a bank that was willing to give me $35,000. Went through the process. The day the bank approved it, that day I had an email from the suppliers of the equipment telling me that, unfortunately, they had increased the prices of all the equipment by 100%. Now, the bank that was going to give me money, it wasn't for free, it was a loan. And I was going to pay the loan with my personal money. Okay, and I had calculated based on the fact that at that time I was working with Confanochi Teaching Hospital. I was going to earn a salary every month. And then I had a few other things I was doing on the side. If I combine all of that, I was going to use 100% of the money to pay off the loan every month for 10 years. Yes. Okay. And I had motivated myself, and I had decided that this was something I wanted to do because I was very passionate about developing test kits, right? But if it's increased 100%, then it means that not be able to make those payments. And so I had to write the bank telling them that, unfortunately, I cannot take the offer. I remember that day very well. Okay, I was in some jeans, white top, and then my shoe, some brown shoe. My house at the time I was living in an apartment. It was a story building. I was at CATH. I was at Confanochi Teaching Hospital when I received the email. So I sent the email to the bank, packed my things, went and sat in my rickety car, and drove to the house. I got home, I parked my car outside. Okay. Climbed up the stairs, went and stood in front of the shower, under the shower, opened it, and started crying. Okay. Because it was just like all my dreams were just crashing. You know, like, when you have $100 million there and then it starts reducing and now it's zero. Okay, good. That was me at that moment. And I don't know how long I cried, but I was wearing my shirt and everything with my shoes, and I was standing under the shower, and the water was just pouring down like that. And then I slept. When I finished, I cleaned myself, and then with the wet shirt and trousers and everything, I went to bed and I slept. It was like 4 p.m. I woke up around 11 p.m. Then I remembered that I had parked my car outside. I went outside. They had stolen my car tape and they had stolen my car battery. So I just left the car there. I was like, oh, master, I just left the car there, went back upstairs, and went and continued sleeping. So the, the next morning, I just went through a haze. Hello, we've not even gotten anywhere yet. Yeah, I was just walking. For the next 2 or 3 days, everything was just a blur. Okay. Then I received an email from a Professor Lennis. Professor Lennis is a professor of biomedical engineering at Purdue University. And when I went for the Mandela Washington Fellowship, I had met her. Before that, I am very interested in academia. So I had written a lot of papers. I like learning. So yes, I know a lot of people. When people ask me what's my hobby and I say studying, a lot of people are like, yeah, but that's one of the things I like doing. Anyway, so I had written quite a number of papers that she had been interested in. So we had a few conversations. Also, when I went to the US, when I went for the Mandela Washington Fellowship, the kit that I had developed, the VAC kit, it was being tested in the CDC. So I was in the CDC. And at the CDC, I had met somebody called John Deutsch. And John Deutsch was an old man, but he was a very influential person. He was in STD division. And he was basically into point of care tests. So I was very interested. I had spoken to him a lot and all of that. And so he sent an email to Professor Lennis saying that, oh, he feels that the two of us can collaborate. And we're like, oh, we've met, but we didn't really talk that much. Long story. Anyway, so Professor Lennis had written to me asking me to come and join her in her lab in the US because she had won a grant to develop an HIV test. So it was a mobile phone enabled HIV kit. They wanted to do, when somebody is HIV positive, you go to the lab and then they do what we call viral load. In fact, that's now hepatitis B, we do viral load and all of that. This is a very expensive test. A few years ago, I think 2013, 2014, it was around 400, 500 cedis. So I don't even know how much it will cost right now. I'm sure it will be more than 1,000 cedis. Yes. And she had won a grant to develop a mobile phone enabled device. So it's a small device. You take your a finger prick, put it on your iPhone, okay, and you'll be able to calculate your viral load for you. So you did not need to go to the hospital and get all of this done. So she had won a grant to develop something like that. And she was recruiting people who had background, because she had only 2 years to do this. So she had recruited people who had background in development, test kit development, so that we could do this work. So I said, oh yeah, right now all my hope is dashed. So why not? I'll come to the US. So I joined her in her lab, and then we had an agreement. I had an agreement with her and the university. So we're going to develop two things. The HIV kit I was going to develop for the university, for her and the university. And then I get to develop one other kit, which will be 100% mine. And that one other kit, they are going to give me all the funding and everything to do that development. So that was the agreement, which I said, okay, that was a great agreement. And I also said that in Ghana, everything is about degrees, right? I have started developing test kits when I had just a medical degree. I didn't have any engineering degree. One day somebody was going to ask me, what qualification do you have to be able to develop some of these things? So I said, oh, would it be okay if I have an engineering degree as well? I can take all the classes you need to take and do all of that. They said, oh, it's going to take a lot of time. You have to spend lots of time in school and in the lab and all of that. You will not have any social life. And I was like, don't worry about social life. So yeah, I got enrolled and so I was schooling. I was doing my master's in biomedical engineering, and then I also I was also working in the lab on two devices: the HIV one and then my device, which was for a test for infectious diseases in children called YORS. So it was a kit I was developing called the YORS kit. Now, I would wake up in the morning, maybe around 4. And Indiana is a very, very, very cold state in the US. It's very cold. And you wake up around 4, walk through the cold, go to the lab. You be in the lab until 8:39. You go to class. You close from class. You come to the lab class, like that. And then also, one thing I did was that anytime I heard there was a pitch competition anywhere, I would get up. Even if I have to fly across different states, I'll go and pitch. So by 2018, May 2018, when I had finished developing the HIV kits for the lab, I had finished developing my kit for yours. I only needed to test it out. I had won quite a number of money. I had won about $200,000 in pitch competitions. So I bought equipment, shipped them to Ghana, told my boss at the time, Professor Lennis, that I think I've fulfilled my part of the agreement. I had done everything. I had finished all my academics. I had developed my kit. It was just like with the thesis. So I wanted to move back to Ghana to set up my company. When I finish with the thesis and everything is okay, I'll come back and defend. She was like, cool. But I'm not going to cancel your contract. Go. I'm going to give you 3-4 months. If after that you decide that you want to stay in Ghana, let me know. I'll cancel your contract. If not, I'll come back. You can come back to the US. I said, oh, no problem. I'm not sure I'll come back, but you let me go. Thank you for the opportunity. And then I came to Ghana. Set up a different place. FDA came. FDA said, no, this place is too small, so you need to expand it. All of those things. So we got a place ready. I was very confident everything would be okay. Then equipment came. When the equipment came, I went to the port. I was told I had to pay 50,000 Ghana cedis to clear the things from the port. 5,000 I didn't have. Okay. So I had to look for money. And then I did get some money from somebody. The person says, okay, I'm going to give you 50,000 cedis. But every month, you are going to pay me 15,000 cedis. So at that time it was 150 million. So you're going to pay 15,000 cedis as interest on the 50,000 cedis per month. So I said, okay, I need the equipment because the more the equipment are in the port, the more I'll rack up charges. And I didn't know where I was going to get the money. So I said, okay, you I'll pay. Give me the money. I signed to the agreement. And so I had no option but to go back to the US to go and work small and get some small money. So fortunately, when I went back to the US, I had a job. I had finished with my academics and I had finished with what I was doing. So I had a job with Abbott. Abbott is a diagnostics company, and I was one of the R&D scientists. My salary at that time was $12,000 a month. So from 2018, somewhere September to about May 2019, I was earning $12,000 a month. Every month I will send $10,000 home for them to use it for other things. That's also a whole story. The person I was sending to was never using it for what was supposed to happen. So it got to a point where all the staff I had at the time, they quit. And at that time I didn't understand, because I was sending you money for your salaries to be paid and all of that. But they all decided to quit, and they quit at the same time because they felt that, one, there was no hope for the company. Two, they were not getting anything. They were just there, and they were coming to work, and nothing was happening. So they all quit, except one guy. So March 2019, I had to make a very important decision. At that time, the VAG kits which I had developed had been selected for the Innovation Prize for Africa. And the yours kits that I had developed had been selected by the World Health Organization as one of the 30 innovations in Africa. So, in health. So, and I had monies, small monies from this, and I had made a few savings. So, I decided that I was going to come back to Ghana. At the time, and where I was working, we had this magazine where it was online. Every time, every week, they would post about what was happening in the company. And it was usually distributed to everybody, including those in the area, like those in the town, in the community. And since I joined, every single week I was on the front page because I was always developing something new, or there was some innovation I had brought in, or there was something I had done. So the blacks in my community used to call me the rising star because every time I was on the magazine. And then in March 2019, I decided I was going to quit and come back to Ghana. I told my pastor at the time. So I'm a Catholic, but in the US, if you need kinky, I love kinky. So if you want kinky to eat, you have to go to the only black church, which was the Church of Pentecost. Yes, the Catholic Church in the US, everybody is white. You can get, and then long story anyway. You can put it. So I used to attend Church of Pentecost in the US, and I told my pastor about it, that I was quitting. On Sunday, they did a deliverance service for me because I mean, they could not believe that somebody with such a bright future and you are always like, everything showed that you were rising and all of that, and all of a sudden the witches in your family will say, come to Ghana, come to Ghana, come to Ghana. So they did deliverance service for me. They prayed and prayed and prayed. 2 weeks later, I left and came to Ghana. So between March, April 2019 and August, I put everything in place, got new staff and all of that. And we developed more tests, so pregnancy and all of that. We got FDA approval, and by November of 2019, we were ready to start selling big time. And then COVID came. So, and before that, I think this point is very important. One of the things that happened to me in 2018 when I came after the import duties and I couldn't pay and all of that was that I started having depression. Okay, I started having panic attacks. Even when I went to the US, like I would have constant panic attacks. I remember there was a time I was just walking, and then all of a sudden, ping, I turned around. Apparently, I had walked into the middle of the road without knowing what was happening. And over there, you do that 2-3 times. I was there when they came to my house, put me in a car and sent me to the hospital. They thought I was suicidal. I wasn't. Life is too sweet to kill yourself. So I wasn't, but they assumed that I was, because for me to just, and it didn't happen once. I'll be there and then I'll just walk into the street and then all of that. So one of my nosy neighbors, who was of course white, decided to report me. Okay. She decided to report me, and they put me, and that also put me further into debt because it wasn't free. Hospitalization wasn't free. So I needed to make that point. Anyway, so 2020, we came, we had a meeting. We're going to, what's the time by the way, so that I don't exceed my time? Oh, okay. Okay, I have about 30 minutes. Let me fast track things. So 2020, we decided that we're going to do this. We're going to start selling, and then very early January, we started hearing about COVID and COVID-19 and all of that. So I called a staff meeting, all my staff, and then I said, what are we going to do about this new pandemic? At that time, it wasn't in Ghana, and at that time, it wasn't even a pandemic, about this new disease. What are we going to do about it? Because if it comes into Ghana, we're going to have a lot of trouble. At that time, too, we had products that we wanted to sell. So how do we get our products for people to sell? So my CTO, she's called Francisca, she suggested that, why don't we develop a test kit for COVID, so that we will donate the test kit to the Ministry of Health. Once we donate the test kit to the Ministry of Health, the Ministry of Health will then know that, oh, there's a company in Ghana that does something like this. Then they can buy our pregnancy test, our drug of abuse, and all of that. So I felt it was a good idea. So we invested some money, almost $35,000. And then by February, we had developed the test. Because I'm a lecturer at KNUST, anything I develop, KNUST owns part of it. So when you hear that KNUST in collaboration with this developed this, it is because I am in KNUST. Okay. So we basically developed it. There was a lot of noise about it. We got interviewed everywhere. And then we went to the FDA. It wasn't passed. Okay, it was not approved. The first test was not approved because the FDA wanted a certain level of sensitivity, which at the time we had not achieved. So they didn't pass it. So we came back to the lab, worked on it for a long time, developed an antigen test. During the process, in fact, and this is where the ethics come in, I was approached by several entities, okay, saying that, oh, we can go see this person, we can go see this person, we can just give this person something small and things will work out. Okay. At the time, if our kits had been approved, okay, that was millions of dollars. Because there was no kits like that anywhere. Okay, so my test kit was going to be hot cake. I was going to develop, we were going to make a lot of money. We would basically set the price and other people would just come and buy. But I said no. If the kit was going to be approved, it should be approved on its own merit and not because I had given somebody money. And so the kit was not approved. So we went back, developed an antigen test. I will not go into details, but during the whole process of let's do this, somebody offered to buy the company. And I refused. A very big person, offered to buy the company and I refused. And the person said, we shall see. Within a short time, we had a lot of trouble. GRE came to inspect us. All the people that are supposed to ensure compliance, those that are not even minded as they all came to inspect. They gave us bills. We had to pay huge sums of monies in penalties, withholding tax, this tax and all of that. Charlie, it was not easy. Still, I said no. Long story short, our kit is one of our best sellers, but not in Ghana. It's being sold in the US, it's being sold in Kenya, it's being sold in Liberia, it's been sold in about 5 different countries. We are making quite a bit of money from it. Okay, but it's still not been approved in Ghana. Okay. The upside is that in all of this, the Bill and Melinda Gates Foundation, as well as a lot of other foundations, Grand Challenges Africa, Grand Challenges Canada, I didn't apply. They did their own search, and they all selected me for one fellowship or the other. The Bill and Melinda Gates Foundation, for instance, they contacted me and said, oh, Somebody called me out of the blue and said, "Oh, they wanted to speak to Lord." I said I was the one. He said, "Okay, I'm from the Bill and the Gates Foundation." I rolled my eyes. I was like, "Scam." He said, he said they had selected me as one of the Gates goalkeepers. I was like, "Yeah, right." And then they said, "Oh, but we are going to send you an email and all of that. We just wanted to confirm." I said, "Okay, okay, bye bye." I didn't even check my mail because I knew it was a scam. And then a few days later, I did get a mail, and then they scheduled a meeting. Also, it was Skype. I was supposed to talk to Bill Gates and all of that. I was like, okay. And then this meeting, I remember this meeting, it was Skype. I was sitting down waiting. And then there was, when it came on, there was a conference table, long conference table, and there was nobody seated. So I sat down, and then all of a sudden, it slowly became occupied. And Bill Gates. So we spoke about COVID, what COVID was doing, some of the things that were happening in Ghana. And I think the day after he spoke to me, he spoke with the vice president of Ghana. Yeah, because the vice president tweeted about it. But at that time I had an NDA. I was not supposed to announce it until they had officially announced it. Otherwise, I'd have made a lot of noise on Twitter about it, but I didn't get the opportunity. Anyway, so we had a conversation, and then he told me that as a Gates goalkeeper, they were going to come around. They were going to do some videos and all of that. But I was eligible for $100,000. So I said, "Oh, is it possible for me to for you to use my $100,000 to buy as equipment, because it was difficult buying some of the equipment?" And he says, "Oh yeah, speak to Brian. Let him give you a list of the equipment. Give him a list of equipment you need, and then let's see what happens." So I said, "Okay." And then I went and looked for all the equipment I could think about, wrote them down, sent them to Brian. Somewhere in December, I was there when I was sent the commercial invoice, $2.8 million. That was the equipment that they had bought. So the equipment got to Ghana. I had to go and clear it. Yes, I had to pay over 100,000 Ghana cedis to clear them. But this time I did that. Master, they bought equipment $2.8 million. You not use $100,000 to clear it. I went to look for money and I cleared it. This time happily, because it wasn't a problem. So we've basically moved our production capacity. We used to produce about 2,000 test kits per week. Right now, our test kit production capacity is 100,000 test kits per day. Right now we have 37 employees. Okay, we have 37 workers, and the 37 workers, we have 19 females and 18 males. And out of the 37 workers, most of the technical team is made up of females. Okay, and so we've actually come a long way. It's been really good. And the most important thing, you remember when I refused to sell the company, I refused to pay certain amounts of money and all of that. What we did was to suffer a few consequences at that time. But the long term, how it has helped me is that right now, the company is collaborating with Cambridge University to develop diagnostics. We are collaborating with Path. In fact, I need 3 of my engineering, so 1 electrical engineer, 1 materials engineer, and 1 mechanical engineer. We recruited them for this year, just this year. They'll be going to the US for 6 months in February. They'll be going to Path because they are going to be trained on how to do some of the things you want to do. Okay. and they'll be there, and they are service personnel, so they'll go and work. By the time they come back, service would almost be ending, and then we'll give them full-time employment. Okay, we are collaborating. The WHO, for instance, we are the Yours Kit that was selected as one of the top 30 innovations. We are currently doing large-scale clinical trials with Noguchi Memorial Institute for Medical Research. It is funded, fully funded by Grand Challenges Canada, Grand Challenges Africa. Like, so many good things are happening right now, okay, because we did not take the shortcuts, okay. The lessons I have learned, my time is up, so I don't want to talk out. I would open floors for more questions, but I'm just going to tell you about a few lessons I have learned, okay. The first, okay, you might not be very religious. You might not be very religious, but I have learned over the years that when you believe in a superior being, God, Allah, whoever you believe, so long as you believe in a superior being, there are certain things, okay, that you don't let it get to you, and it helps you across, to go through a lot of things. There were times when I did feel like giving up, several times. Okay, I found that believing in a superior being and being able to pray. Okay, I'm not very religious, but sometimes just the whole prayer thing, okay, it calms me down. Okay, so you can give it a try. Just believing in a superior being would usually is one of the lessons I've learned. The second one is to have a dream. Okay, your dream cannot come true if you don't have one. If I ask you right now, where do you see yourself in 5 years? If you cannot tell me where you see yourself in 5 years, it means you don't have a dream. And how do you then fulfill that dream if you don't have one? Do you understand what I'm trying to say? So, one of the things I would like you to do is to be able to think to yourself, in the next 5 years, where do I see myself? And be specific about it. You can decide that, okay, probably I'll be done with school and be doing my national service here at this particular company. That is a dream. If you just say, oh, I'll be done with school, I'll be doing my national service, it's just like there's no direction. You should be very specific in the things you want to do, because once you decide that maybe I want to do my my national service, let's say at the US Embassy, just an example. That's where you want to do your service. Everything you need to do to get there is what you then start doing, right? So you start putting strategies in place to be able to get that. You start thinking about the network you need. You start planning towards achieving that aim. When I was in second year in the university, I had a 20-year plan. In 2017, I turned 30 around that time. Okay, I put together another 20-year plan. Okay, and as at now, every year I take my 20-year plan, look at it, and ask myself, which one can I do right now? And so every single year I have a plan, and that's the third thing. Have a plan and write it down. So I have my goals for 2021. I have my 5-year short-term goals, and I have my 20-year plan. So I'll give you an example. So I want to be the Director General of the World Health Organization. That's my plan. No Ghanaian has ever been the Director General of the World Health Organization. I am going to be one. So mark it. When you hear the announcement I've been made Director General of the World Health Organization, you remember that I told you guys I was going to be that. Yes. So that is the plan. Now, how do I become the Director General of the World Health Organization? One, I need to have an expertise in an infectious disease area. So I have an expertise in microbiology. I have another one in immunology. I'm getting another one. So that instead of one, I would have 3. Overqualified. Okay. I need to be able to speak at least 2 of the WHO languages. And the WHO languages are English, French, Spanish, Arabic, and Russian, right? I can speak English, I can speak French. I'm learning Spanish. When I finish, I'll go and learn Arabic. Okay, what? Overqualified. Adelaide? Good. So, it is because I have a goal, right? It's because I have a dream, and the dream is to be the Director General of the World Health Organization. Okay? That is why I know exactly the path that I need to take. Of course, you can get all of this, and then when you get to the final one, you need 2 things. You need your government to nominate you. That means that I need to get a politician as a friend. Okay? You need your government to nominate you, and then you need all the other member states to vote for you. Okay? So that is the one I still do not have. I know what to do, but I've still not developed a strategy yet. Maybe I have to look for somebody who is a rising politician and become that person's friend so that when we get there, the person will nominate me. Anyway, so the point I want to make is that when you know where exactly you're going, when you have that dream, okay, and you write it down, you can devise strategies through which you would get to that dream. You will get to achieve that particular dream that you want to. Do you understand? Okay. So, superior being, God, have a dream, write it down, plan and write it down, right? The 4th one is network. It is extremely important. I have seen the list of the people who are going to do this leadership series with you, and the names are mind-blowing. In fact, I was even asking myself, hey, looking at all of these people, where did I pass to come and be part of those that have the opportunity to speak to you? Okay. This is a big opportunity for you to network. Okay. I can do a whole 2-hour talk on networking. You should be able to talk about yourself in a way that will make you remarkable. It will make you memorable. Everybody would be able to remember you. When you meet people, first of all, you need to ask yourself, where am I right now? Where am I going? Who can help me to get to where I am going? Right? And then when you've identified people, don't worry if that person is even the president of Ghana. Don't worry. Just write the names of everybody you think can help you get to where you are. You will not be able to know everybody, or you'll not be able to know who can help you. So generally when you meet people, take their numbers, keep in touch with them once in a while, send messages, have a conversation once in a while. Don't flirt. Okay? No, I'm serious. If you're a lady and you take somebody's number, you want the person to help. Don't start talking like that kind of thing. The person would read meanings into it and would come and disturb you. I'm sure you don't want that. If you're a guy and you also take a lady's number, don't be sending the person certain messages and all of those things. It will not help. If you take somebody's number because it's professional, keep it professional. Do you understand? Keep it professional. Once in a while, good morning, sir. I just wanted to reach out and say good morning. Happy Father's Day, sir. Have a good week and all of that. Good morning, madam. That kind of messages. Always make sure that the person you are in touch. Once in a while, the person will ask you, "Oh, how are you? What are you doing now?" Don't worry if the person has even forgotten what you do. "Oh, what are you doing now?" "Oh, I'm still in school." "Which school?" "Oh, you came to academics." "Oh, okay, yes." "Oh, what's your name again?" And then then keep it up. One day you will need the person, and the person will help you. Okay, that works. But for those you've selected, those you've actually written, like maybe some of them you've written their names and say, this person can help me, this person can help me, this person can help me. For those ones, you would need to actively go and look for them through either emails, either contacting people who might have their numbers and everything. You need to actively, build your network. And this is the right time for you to do that. Okay, this is the right time for you to once you're in school, a lot of people are willing to help you. This is the right time to build that network, because you can do all of that, have the perfect dream, have all the things written out. You will need somebody to introduce you to somebody to open doors for you. Everything I've been able to achieve right now, John Deutsch introduced me to Professor Lennis, right? A lot of the things I was able to do, somebody introduced me to somebody, and that got me opportunities. And so you need to be able to build that network where somebody would introduce you to somebody. I deal with Cambridge. Okay, somebody introduced me to Jenny Malloy, who was like, "Oh, okay, I'm also interested in this. Let's collaborate." And right now, I have a deal with Cambridge University. My deal with Path, somebody from Grand Challenges Canada did that arrangement. So you will always have somebody introduce you to somebody. And so you need to build that network. It's very important. The final one, is hard work. Look, you can have all the everything and have the best network. It will only get you to the door. If you do not work hard, you'll be kicked out. Those who know me know that I work extremely hard. Sometimes even in the night, I am working. I have a room in my company, a room where if I want to develop test kits, I sleep there, and then in the night, around 11, I'll wake up and I'll be in the lab until around 4. If you don't work hard, and unfortunately for this generation, when you talk about work, the first thing is how much are you going to pay me? It's very important. My company offers paid internships, but not every company would give you paid internships. You need to ask yourself, what do I want to achieve? And am I willing to work without money for it to be able to learn what I want to do? Remember the example I gave about Doxa? I worked for him for a long time without being paid. But in the end, it paid off because at the end of the day, I got to do food screenings, which gave me money that helped me to be able to go and learn how to develop test kits. There are a lot of opportunities that are available for you. Right now, some of the things you need to do is to start volunteering for things. Because look, if you want a scholarship, you want anything, some of the things they are looking for is leadership experience and then community development. How do you do community development? By volunteering for organizations, by especially in organizations that do community development. You can volunteer for them. And leadership does not mean that you are the class president or you're holding a leadership position. You need to put yourself in a situation where at the end of the day, you get to exhibit leadership. And you cannot exhibit leadership without integrity, without personal work ethics. So it is important that you define for yourself what your ethical principles are. There are certain things you tell yourself that you would never do, and then you try as much as possible to follow that no matter the situation. You might have immediate consequences, but the long-term gains would outweigh the immediate consequences that you have. So I'll stop here, and then if you have any questions, I would answer you. Thank you very much for having me.
So thank you for your presentation. I want to know what's the name of your company and where can we get your product? Thank you.
So my company is called Incas Diagnostics. You can Google it. Incas Diagnostics, incasglobal.com. So, Incas Diagnostics is the name of all our social media handles. So, Incas Diagnostics. Our products are in some pharmacies. We are expanding. Most of our customers are laboratories. They buy in bulk, and then they use. So when you go to the lab, they use our product. Some of our in 2022, we are rolling out an app which would enable people to buy our product. One of the things we are going to introduce, and we are piloting it in KNUST, is that we are going to have dispensers where we are going to sell our pregnancy test. We are going to sell our ovulation kits. We're going to sell post pills and some condoms. They are going to be in dispensers, and then you just put in the money, key in what you want, and it would dispense it for you. We are also going to do you can also buy through our app, and we'll bring it to your doorstep. But we are piloting it in Kumasi to see how it will go. The company is located in Kumasi. The headquarters is in Kumasi. We have a branch in Accra. Just here, Hacho. She's our branch manager. So basically, starting next year, we are going to pilot that, and see. You can buy our kits from our app, but you can go to a pharmacy and also ask for our product.
Okay, so Sam, my question is, you see, you mentioned about having a long-term goal, but we don't know what happens in future. So let's say you plan like a 10, 20-term goal, and then in the course of 5 years, maybe an accident occurs or you lose an arm or something. How do you quickly switch from that, since you've got everything planned out and that one incident can destroy that whole 15? So the second question is, please, we want your number. So, yeah, me and the boys. So, yeah.
Okay. So you can Google it. If you Google it, you see my name and my number is online. So, yes. And if you Google my name, you read a lot more about what I've been up to and all of that. Okay. Now, to answer your question about planning, the future is not certain, right? I'll give you an example moving from Kumasi to Accra, right? If I decide that I'm going to Accra, okay, and I fuel my car and everything, and I leave home, and I know that Accra is the direction I'm going to, anything can happen on the road. I can have an accident, my car can get spoiled, a lot of things can happen. But it does not mean that I shouldn't take the journey, or I shouldn't know where I'm going. Assuming that I even get derailed, maybe I get to Bonsi Junction, then that door, and instead of going through Suma, I decide to pass through Kofodia. I still know where I am going. I have just taken a detour. I've just taken some pad because I have to go and do something else. You get the point. However, if I get up, fuel my car, and I don't know where I'm going, I'm just sitting in my car and I'm driving, hoping that I'll get somewhere. I will drive and I'll never get anywhere because I don't have a specific destination. Do you understand? That's the same thing with planning and having a dream. If you don't have a plan, a dream of what you want to do, every direction that the wind blows you, you would go. So you see that you end up with somebody who has taken so many opportunities. This after comes, the person is an after ambassador, talking about after everywhere. Then SDG comes, the person moves to SDG, and the person is talking about SDG everywhere. The person is all over the world. I mean, all over the place, all over. Because the person does not have a dream and a focus. Do you understand? That is what you become if you do not have a dream. Any opportunity you have, that's what you do. I always say that there are certain opportunities that are distractions. If you know where you are going, there are certain opportunities that will come to you and you tell yourself that this is not part of my path. So I'll let this opportunity go. As I stand here, I've had several opportunities to move back to the US to do one or two things, either to teach or to do something. But I have always said that it is not part of my dream. It is an opportunity that will make me money, but it will derail me in the fulfillment of my dream. So I will not take those opportunities. Do you get what I'm trying to say? So, yes, you never know what will happen, but once you have a plan, it will help you to be able to maximize the opportunities. I always say that in Africa, we have a lot of talent. talent abounds, but opportunities do not. And opportunities do not because a lot of us do not really know what we are doing with ourselves. So we are not able to strategically place ourselves to be able to take some of the opportunities that come our way. Okay, so planning is very important. Don't worry about what will happen. If you once you have a plan, something happens, it's a living document. So even though I have a 20-year plan, I keep changing it. When I can get up today and be like, no, I said I wanted to do this, but I've changed my mind. I can remove it and I can add something else. It's a living document that guides me. You get the point. It's not rigid. Okay, so even if you leave your arm or you lose your arm or you have an accident or anything, you can add to the plan and move on. Okay.
Thank you for your presentation. During your presentation, you said something about when you were studying on the side, going to the lab, so you didn't have time for social life, right? With that, I presume there was no time for relationships, okay, with females. So I want to ask, when you picked that up along the journey, okay, to now start, like, you get my question?
This is an exam question. Okay, so let me be very, very blunt with you. Let me be very, very blunt with you. All those that do engineering, okay, you are told of trade-offs, right? You know what trade-offs are? Or you've not gotten there yet? Okay. And even those that do economics and all of that, you have opportunity cost, right? Good. So when you are developing a device or you are developing something, you need to have trade-offs. Do you maximize the quality, okay, for the price? Okay, in which case it means that there's a trade-off between quality and price. You make the quality medium so that the price can come down, or you make the quality high so that the price will also go high. So those are called trade-offs. The trade-off to some of the things we do is that you do not have a social life. Okay? When I say you do not have a social life, I don't mean you do not go out and have fun and all of that. Okay? I travel a lot. I have fun. Okay? But the thing is that it becomes very difficult for you to keep and maintain a relationship. Okay? Because relationships are very, I mean, it's you have to put in the work. You have to put in hard work. Okay? And if you are on the go all the time, okay, you're going to have issues with your relationship. I have had relationships, not relationship. Relationships. No, making I've had relationships, and it's been most of the issues I've had with my relationships has been the fact that I do not have time. Okay, and when you are building a business at a point up to this point, you need to admit to yourself, or you need to find somebody who would really, really, really understand that you can go days, weeks without seeing the person, or even without talking to the person. Unfortunately, you meet people who tell you, "Oh, I understand." Then 2 weeks later, they're like, "No, I don't understand." So to answer your question, I am still looking for the answer to your question. Okay, I haven't found that balance yet. Okay, but we'll get there someday. Yes. Hey, it be like anytime I finish a question, then more hands come up because there are follow-ups. Yes.
Thank you very much. Please wanted to ask how was like managing a business in Ghana even though you were abroad? What kind of person did you entrust?
Excellent question. Excellent question. It was very difficult. It was a very difficult thing. In 2018, if you remember, a lot of them left because I had entrusted somebody. I was sending money, and then the money never got used for what it was. So it was a very big blow. So what I do is that right now it's not one person that manages the business when I'm not around. I have heads for various things. So when when I have to go for long periods of time, my head of finance deals with the financial aspect. So every financial decision that person has to take. We have a head of operations who basically the two of them would basically have to take decisions when it has to do with finances. Then you have the chief technical officer. You have so everybody basically handles the portfolio that they have to handle. Okay, but the head of operations is basically the one who oversees everything. But because all the heads are equal, it's difficult for that person to take single decisions, and so it always has to be a decision that they all take together. Okay, and unless all of them then sit down and decide to mafia me, it's right now everything is quite stable and things have been moving on even better than expected since I started doing that.
You said there is a period where you felt in depression. How did you overcome this?
Oh, very good, very good, very good question. Yes. So, again, I am not one of those who would like to come and give a talk about entrepreneurship and paint a very, very rosy picture about entrepreneurship. Especially entrepreneurship in Ghana, you need a lot of tenacity. You need to be strong. Okay, you get depressed a lot. For me, I was very fortunate. The first time I had a depression, I was hospitalized. So I got to talk to a psychologist. Before that, if somebody had suggested that I talk to a psychologist, I would have told the person was crazy. But talking to the psychologist that I had in the US, I realized that, actually, after talking, sometimes you just need somebody to talk to and somebody who will listen and just be saying, and then. Because the psychologist I had in this thing, she never asked, like, honestly, I don't know what exactly she did, but you just go there and after her first question, so how was your week? And then I'll talk until I get tired and she'll be like, okay, your time is up. But I realized that once I come out, I'm like, it's like a burden has been lifted because I just had somebody to rant to, somebody I can talk to, somebody I felt will not judge me. So since then, I've had quite a number of depressive issues, and most of the time, in Ghana, I have a psychologist I talk to at Ridge. But most of the time, just getting a buddy, somebody, a friend I can talk to. Because there are times late at night, when I go to see my psychologist, I pay. But there are times late at night, you wake up and you are all concerned. What if tomorrow this doesn't happen? And then your heart starts beating and all of that. And then you start sweating, you cannot sleep. You should have that friend you can pick and call and be like, Charlie, this is what I'm going through. And that friend will, okay, talk to me. And that friend is silent. And then you talk. Sometimes, by the time you finish talking, you realize that, why am I even worried? You get the point. So, yes, getting. And unfortunately, we are not very, we don't like to talk about our mental health. Even in school. Sometimes you're in school, things are not working well. Your exam results are not the way it is. You just need somebody to talk to. And you're afraid somebody will tell you that, but you are not studying. If you were studying, your results would have been good. So why are you complaining? You get the point. You just need somebody to talk to, because sometimes when as I said, I teach in a university, and medical students like this, they get a lot of pressure. And sometimes I tell the students that when you need somebody to talk to, when you come and you are talking to me, I'll keep asking, okay, so during the semester, what are the top 10 things that took your time? Then they will list, okay, which of them can you do without? Like, once you talk to the person finishes and the person says, oh, okay, oh, thank you very much. Because just listen to the person talk, okay, without judging the person can do a lot of things. So I'm not asking you, if you are having depressive thoughts and all of that, you don't need to go and see a psychologist. That would be the perfect thing to do, but you might not have the money or the time or anything to see a psychologist. If you have a counseling unit in the school, that's better. But getting a buddy, getting a friend you can talk to. Because there are certain things, I know you will not be able to walk to a counseling unit to go and talk to the counselor, because you yourself, you are shy to talk about some of the things that you want to go and talk about. But when most counseling units are those that do the counseling, they are not, they do not judge, but you should also have a buddy you can talk to. Okay. Yes.
So, me personally, the business I want to start is not a white collar business. I want to be a musician. Now, when you are doing music, you really need to get people to know that, oh, this person does this. And you said something about like your social life. I feel like if I take your advice on not really having a social life, I'll only be singing for maybe my roommates and my best friend. So the problem I have with these things is
Okay, so let me explain. Having a social life does not mean that you do not have a social media presence or you do not have a social presence. Okay, there are two different things. So he will tell you that I am very active on social media. Okay, I am very, very active. I do a lot of things. I go out, I have fun, I have a lot of friends. Okay, when I talk about the social life, I was talking about relationships, not having a relationship. I mean, I am old enough, I should have been married by now. That's what I'm talking about. Okay. Yes. Not about having a social life. You need to have a social life, because if you don't have that work-life balance, it will also lead to depression and all of that. So don't worry, I'm sure if you like visiting restaurants, you will see me a lot. So it's not just that you don't have a social life at all. Okay.
I wasn't talking about relationships. I was get networking. I feel
networking and social life that you should have. It's very essential in all businesses. Because you have a business, you should have social media presence and all of that. It's very important.
Like you talked about a person who wanted to buy your company, a big person, and when you refused, the person said he'll show you. Like making threats and stuff.
Not see me. He said I'll see.
Oh, you'll see.
Yeah.
All right. So my question is that here in Ghana, like there's a lot of corruption going on and stuff like that. And for entrepreneurs or people who are starting to become entrepreneurs, this makes it difficult. Plus, people here really do not appreciate entrepreneurs. Yeah. So my question is that, what do you think it would take for Ghanaians to actually appreciate entrepreneurs and then give them a chance?
Have you heard of the, I think there's Ghana Integrity Awards or something like that. Okay. We've started to appreciate people we feel have integrity. I think we need to start having more of those things. We need to start having people with integrity being, or people eschewing corruption being the norm rather than the exception. When you start a business, even in the registration of your business, if you're not very careful, you start engaging in corruption then. Because you have to register the business. You go to Ghana Registrar General, and then immediately you get there, there's a whole queue. You have to go through the process and then put in your card, and it will take months for you to get it. And there's a middle person sitting there and says, give me this, you have it in 2 weeks. The tendency for all of us is dash the guy the money, let him do the thing, 2 weeks, you have it. Once you do it, nothing pricks your conscience. Then you start your business. Okay. Then you start, because you spent a lot of money in getting the business, you overprice. Okay. And you think it's business. So nothing goes into it. Okay. Then it starts very, very small. Maybe there's a contract you've heard of. You want to bid for that contract. You go, this one says come and settle me. This one says come and settle me. This one says come and settle me. You go take money, settle all of them, get the contract. And sometimes they'll tell you, you know that the contract is, let's say 10 cedis per this thing, but in a negotiation they say, oh yes, 10 cedis is yours, you can take it, but you give this person 5 cedis, you give this person 5 cedis, you give this person 5 cedis, you give this person 5 cedis. So that's 40 cedis. I mean, 30 cedis plus yours, 40 cedis. So you are officially going to charge 40 cedis. And then after everything has come to you, you are now, everybody else will come and see and you now pay them their money. You think about it and you're like, well, I need a contract. So you take it. By the time you realize, you get to a point and you realize that you are neck deep in the whole system. But if that person did all of this and you told the person, no, I won't do that, you lose the contract. That is the immediate consequence. Okay? You will lose the contract because they won't give it to you. And it will be difficult for you to get more contracts. Okay? But I can promise you, at least from my experience, okay, that better things will come. Currently today, as I speak to you, 90% of my revenue doesn't come from Ghana, although it's a Ghanaian company. If it was left with just being in Ghana, I'll not even be getting 10% of the current revenues we get. 90% is outside Ghana. We are getting a lot of grants, we are getting a lot of collaborations and all of that because they've looked at the struggles, okay, and they've seen that we've not dabbled in politics, in corruption and all of those things. It gives you a clean bill of health that, it gives the company a clean bill of health that makes it attractive for investors and other people. In fact, there are grants when you apply for, they'll ask you whether you have anybody who is politically exposed in your organization. Okay. And all of this would come back to either hunt you or to help you. So I would say that it's going to be difficult. Okay, it's going to be difficult in the system right now to say you want to be ethical and everything is going to be top notch. It's going to be difficult. But I can also tell you that if you go at it little at a time, and then there's you, there's me, there's one other person. Slowly, you are going to start to have a new breed of ethical businessmen and women. Okay, once we have this, we are going to have a lot of opportunities come to us. Other people are going to see it and would like to then become ethical just as we are, and we'll change Ghana one person at a time. Okay? All right. Thank you very much for the opportunity.